Right. Disability discrimination. My particular circumstances. What particular need has what key decisions been made without me? Lancaster, I don't know particular companies. What I do know, the deliberate lack of dignity. What I do know is a victimisation. What I do know is the breach conditions and conduct of all healthcare professionals. Northamptonshire, Northampton. I do not consent to any more communication by phone. 22nd of the 8th, 2018. All lawful goods and services shall now be offered in full disclosure, full requirements in writing. The opt-out service lawfully has been rejected by Langham Place Medical Practice as a proof of posting. That's the opt-out documentation. And since 2018 May, statute law, your NHS Digital, its basic needs, www.medicalconfidential. Kindly check out the website. It gives the codes. I'll turn the camera around and I've got a light. I'll show you. Turn it round. There's nothing unlawful in this document to send to that website down below there. So this went off to the data controller and the manager, public servant in the job role. NHS England, there's nothing in the terms and conditions of NHS England funded. The CEO is a man who has he's got shares in two national private American companies. He's the one pushing all the digital everything online by 2020. So the opt-out section. There is a lawful duty of care in Equality Act 2018. These were the codes that are used individually. The practice employees refused to accept. What? Because I find a website and give you the full information to opt out. There's a codes, computer codes they use. They don't want the public to know. And the national opt-out data system. So they can't trade on your personal data. So it went about information leaflet. I sent the caution. Once data is released unlawfully about me on the 1st of the 6th, that's a Friday, 2018, I shall now countersue for damages. All of my private life data has been leaked to healthcare professionals in Northamptonshire County Council Limited, public funded company. To healthcare professionals without my consent, that's everything from my birth date. I limited, as I got the record, opted out 2010 what to be shared from my medical records and to whom, and to inform me first. This particular health professional has breached her duty of care as a social worker. She rang up, apparently, on the 16th of the 8th, 2018, claims she's a deprived of liberty, doles, trained social worker. That's how she described herself. My letter stated this. It's not disrespectful. It's worded 31st of January 31st of the 7th, 2018. I first sought clarification on since 2018, your data can be accessed as long it is, they provide it within 30 days in a CD format for free. That's a national new policy, United Kingdom. They have not done that. So the reminder letter sent off to remind them on the data controller side of that. These medical private run companies are funded by medical companies. Medical is NHS England. There was even an email provided to make it easier. The practice manager has refused. The data controllers refused. So they've gone to the partners. There's two only, one of them. The one that falsely made assumption about my private life in my home, 17th of March 2017. And when I could not talk with a severe dental infection, he went on a presumption about my personal life and my medical diagnosis, which I didn't even have a particular one he made up of. And on that day, I couldn't speak, I couldn't move, I could not do anything. I was so weak. Now, what is that male, instead of offering a home visit, calling a 999, which it wasn't an emergency, yet he gave away some resources, when two men, one female turned up. After the first observations, they didn't get that right. What they did, and they knew I was on my own and took advantage of my own private right to privacy, right to private life in my home. After the observations, I did nothing unlawful to them. They took major disadvantage. I tried to get friends on the phone by texts. In an emergency like this, I could not do nothing. No did reply. Set up big time. One female got up and nosing in my private food cupboards. One got up saying, "Oh, looks like you're not eating." I can't eat, you stupid idiot. I can't even drink because of the bloody swollen dental infection in the throat. I'm bloody ill like hell and I'm shaking and I'm ill. I need to get in bed. Do your ops and go. Yeah, I couldn't say that, could I? I could try and use my arms non-threatening way to do it. Do you want to know? Next thing, one young woman sits at my table, bits a piece of paper up. 2 to 3 years old. Nothing to do with her. She has no consent. There's no respect to vulnerable disabled patients in their own bloody homes. She sat at my kitchen table, picked a piece of paper and began to read it and made up lies. I rebutted all this now since. And she said, "Oh, I need to call your GP." Who? I couldn't even get consent on the phone for that. I couldn't speak. They went ahead anyway. They breached their duty of their terms and conditions of employment by East Midlands Ambulance Service Limited at that time. Not everyone's like that, but these ones were. They breached their duty of care by the contract terms and conditions by UK public funded, taxpayers funded by NHS England. Now, the CEO of the digital head office in Leeds company has subcontracted out my private life data again. A text came out the blue on the 18th, on a Saturday of August 2018, saying that I'm with a different medical practice. I'm sorry. That is absolutely breach my human rights as well. I did not sign up to a new medical company. I did not receive a letter to give me the reasons of the facts why. My other letters disclaimed the factual reasons of evidence of my lawful right to opt out of the scheme. That's what's recently got rejected. My other letter made it quite clear about the NHS digital process record to opt out of. And that was another third-party company involved, so I opted out of that one. I'm not having people share my data. So, this other data about what happened to me last year quoted a contract code reference. Oh, they don't want the public to know this one. Section 0.79 GMC contract regulations offering accountable GP. Well, they claim somebody's retired, so therefore there's only 2 to 3 men. Right, so there's a female I got on with. I'll appoint her as my accountable GP. That's my lawful right. Instead of writing back or emailing me the correct procedure, well, they blanked me completely. Haven't returned. I was in the middle getting all these referrals and they completely blocked it because I dare again 9 different companies you butted last year. And what happened because of that? There was a public servants Northamptonshire County Council made up lies about me in a lot of documentation dated 19th of 6th 2017, which I've already rebutted. Former Paul Blainton, CEO. Everybody, 9 different companies. So if you get an IT produced letter, they're changing things, it's all going on digital. When you have a disability, please check out the post with the NHS choices, where it makes it quite clear what your choices are. I have not consented to go to this medical practice. I have not signed a contract or anything with them. So that is going to happen. I'm going to have the day tomorrow to myself. I won't be making no bloody phone calls. They can go and do one. Nobody's going to come near me. I will not tolerate the disrespect, the deliberate victimisation by healthcare professionals. I know how it works within the terms and conditions of Statute Law Care Act 2014. Now I'll be doing the counterclaim back. I'll be doing the same to every public servant, and I know exactly who you are and what you're doing and who your connections are and why you're doing it. But I'll be doing it honourably and I'll be doing it lawfully. I won't be wasting my time on it. You won't be seeing me, not until I'm ready. I've waited long enough for you lot to make your act together, and you have to make sure what is offered is proportionate to meet one's lawful circumstances. You haven't looked into that. You will not expect me to travel into a vehicle that I cannot avoid, where all the benefit cuts are going on with that corporation. You cannot expect people with complexity needs like I to be discriminated against by your own private limited company's policies. That's all I have to say right now. And I will not be communicating unless I get a full disclosure in writing in normal post in the next 7 working days. Who is now running the offer adult services for Northamptonshire County Council? Is it Olympics Care Services Limited? If it's so, which employees provide full disclosure? Because I know certain individuals are still working there I dealt with before. You have no guarantees it won't be the same people harming me. And do you think I'm going to allow that again? No. If you want to go the safeguarding route, well, I've got the evidence of what you've done to me. So, that are the clear choices. If you don't know, every town and city what clinical condition groups are, called CCGs, look at their contract terms. Right, a text out the blue comes to by a software company. Would you respond to someone I don't know? No. It goes via NHS Digital, up to Leeds, outsourcing your private data. Where's all that come from? So look at and go through also the medical side. If you don't want to book online for your medical goods and services, that's already dealt with. So they assumed, these medical employees, that I would do things, I'm able to do things online. No. Also be aware how it works. All of my former, all the effort I made, fully rebutted everything made. March, April, all last year this was, and there's a report, 19th of 6th, 2018. You know who you are, Jane. She's the same mental health care professional. She fully hated the fact that I was able to fully rebuttal on the full assumption being made my private life and character. This is a video of full rejection of honour without dishonour until you can provide the full disclosure. Now we're dealing with the contractor company known as LDS Law Limited. We're dealing with the contract company, Total Voice Limited, Total Voice Ability, head office in Cambridgeshire. You're dealing with the CEO man. In each area city, you might have the kindness of the advocates, but they are limiting. An email last week on Wednesday, the 15th, the 8th, 2018, 1 day's notice when I've been waiting 8 weeks. That is out of order. You are not making reasonable adjustments for disabled people. In the circumstances, it was impossible. Trying to talk to you the next day on the 17th, the 8th, 2018. You're making all these promises you know you can't keep because it works by the terms and conditions of offer on funding when all the funding cuts are going on in Northamptonshire County Council. It's a corporation. They have set up the new company in replace of Northamptonshire Adult Social Services Limited, and that deceased as a company on the 31st July 2018. That email's already gone. You fully ignored it. You're in dishonour, not I. So it's gone off to reinstate the fact the new CEO is Teresa, and that is worth investigating. So if you come back here in this video and try and offer a new contract, well, then it's going to have to be in writing. Then if you're required to offer anywhere near my premises, I will be doing a document to gain the full disclosure, what is going to be talked about, what will be required, and put it in writing. I did that before. You didn't like it. And this time, the premises to my location is on my terms, and I will be recording any offers. You want to push the adult safeguarding on me behind the scenes instead? Well, you'll just be going against a brick wall because I honourably and I will lawfully work once you offer the full disclosure. You by now have not offered for disabled people the disability reason adjustments, the full accessible format that's readable, the full equality questions. I suggest you do some training. I suggest you go on disability websites, which is like tells you the fact sheets, how they're meant to work, and train up men and women in the job. But I'm talking about the management level that need to train their employees better. But now I've got to go. My friend is watching me know how distressed I'm being and still and get some sleep. God bless. Don't let the bully boys push you around. And I will be working honourably. And I will find out. It's not going to be a complaint. I will make sure I get my choice. And they work lawfully with me. And they just don't push me into a situation when I'm not ready for. So I'm having a day to myself. I'm not going to take no calls. It's got to write paper trail, email. and I know my lawful rights. You men and women are equal to me. You respect me, I respect you. It works both ways. I'm not being awkward, but the shock of all this, yet again, I've had enough of my bloody woman dying. You do this to me on top. Thanks a bunch.